Okay. Hey everybody, this is Travis Robinson from Robbins Rehab West. I'm here with Evan from Forward Thinking Fitness. If you guys are watching this, you probably know at least one of us, if not both of us. We have a lot of clients in common. But so I do a quick video to educate you guys about really shoulder pain. That's what we're covering on our side of the wall, as we call it in our area. This month and this quarter, actually, trying to help prevent shoulder pain. If you have shoulder pain, help you out with it. So I just want to talk to Evan because there's a lot of crossover between what I do as a personal I took your job title. Do you see that? What I do as a physical therapist, both PTs, and what Evan does as a personal trainer, both PTs. So I'm going to ask Evan 3 questions, and we're going to get some conversation going about how to help people that have shoulder pain. And if you don't have shoulder pain, you should still listen because we can help you prevent it. So Evan, why is preventing injuries so important for you from the personal training side of things?
Certainly. So when clients are injured or they have chronic pain, it definitely limits their performance within their workouts. So then we have to make a bunch of modifications and they don't feel like they're able to push past their comfort zone with us because they are in pain. And so for us, we never want to have clients moving with us and experiencing pain. So we're always going to be very aggressive in modifications to eliminate that pain. But if they're not getting a professional help with you guys or someone else in another related health field, they're always going to be limiting their potential with us here. So we never really want them to be pushing through pain. And it's certainly then going to be inhibitive of them seeing progress with their body composition, their strength gains, their stamina gains, their mobility gains. Everything is really then kind of forced at a lower ceiling, when they have an injury.
Yeah, I think them being able to reach their full capacity, if they're limited by an injury, they're just going to kind of be hitting up against a ceiling, and things are not going to go the way they want them to. And they're probably a little bit nervous about getting injured. Like there's plenty, when you get to my age, there's like, yeah, when my shoulder gets back here, it's not so good. So I just kind of, avoid that. So there's a way that we can modify that. That's important. You don't want them doing nothing, but you also want them to have full confidence in their movement so that you can do more challenging exercises with them, and that's not kind of holding them back. So in terms of shoulder stuff, how do injuries cause problems with clients aside from, you've talked about, modifications, and if they have some limitations in range of motion or strength and that kind of stuff, you can work with that. But if someone has a shoulder injury, like what's going to happen to their treatment plan that you have for them?
Yeah. So if they have a shoulder injury, one thing that would typically happen is they'll just kind of lose that motivation that they had when they were feeling really good. And, they'll take a break for a week or two. And then, maybe I'll talk to them and say, hey, you should really get checked out by somebody if it's sticking around past 10 days or so. Then they try to work themselves back into a groove, but they lost that momentum that they had with us when an injury pops up. And that can be really damaging to someone who, has been working really hard and seeing great progress. And then, an injury throws them off the rails. I mean, we've had some folks that just kind of stop altogether because of their injury. They just need to go get real medical help. And there's only so much that we can do from a mobility standpoint and a warm-up standpoint and a cool down standpoint and modification standpoint for us to work around what they have. So my position with all of our clients is if there's pain that's lasting more than a week, then we really want to get them checked out by somebody who can do some differential diagnosis testing and figure out what is actually happening in that shoulder joint.
Okay, so that's a good segue. So when talk about prevention first, I guess we could talk about that. So if someone's coming in and they don't have any shoulder pain, but you can identify they have some mobility issues and some limitations, what are the most important things that you do from a PT side that helps them prevent having an injury to begin with?
Yeah, so we have a very extensive movement prep, which is what we call, it's a fancy word for a warm-up. And we want to be working on soft tissue mobilization, a lot of posture corrective movements that are going to help to bring those shoulder blades together and down. So we're working on increasing that scapular range of motion through that movement prep. And then also just getting that blood flow to the joints is really important too. So you can't, I mean, when you're in your 20s, maybe you can get away with not warming up and going right into a workout. But certainly as we age, that blood flow to those working muscle groups that you're going to need for your workouts is really important for injury prevention and preventing pain from kind of creeping in during your workout too. So we do a lot of mobility work in the beginning prior to a workout. That's about 10 minutes of a warm up. And then we also do a lot of soft tissue mobilization through foam rolling and acromobility ball work, some trigger point therapy after our sessions as well. So that kind of helps out with the recovery process and gets them primed and ready to go for their next workout.
Nice. So if you're watching this and you are a patient of mine that doesn't know Evan is looking to get moving, this is obviously a big time of year that people start to kind of evaluate their health and say, yeah, it's about the time I kind of work off the holiday decisions I made.
They're gone.
And yeah. So we have a great opportunity for you to learn more about what's going on Evan's side of the gym. We're doing a shoulder pain workshop that's coming up this weekend. So all the information, if you're watching this, it'll be available below. Just got to opt into that workshop because we only have so many seats available for that. So if you're having shoulder pain and you want to come learn more about FTF, this is a great opportunity to do that. And if you're on Evan's list and you're going to the gym and you have some shoulder pain, then this is a good opportunity to come meet Katie, who is our PT that's over in Upper Macungie, and she's doing a workshop on how to get rid of your shoulder pain. Again, there's a big link. You can see all the information in there about what's going to be covered, but it's a 30-minute workshop. It's really quick on Saturday morning to get you guys some information that's need help on either sides of things. You want to get moving more and you don't have too much shoulder pain, but maybe you've had shoulder pain in the past, and you want kind of a refresh on how to prevent that, then you should come. If you're having shoulder pain right now, you should definitely come because you want to get rid of that. It's going to slow down any kind of progress that you're going to make, or at least going to limit your progress if you're working out and wanting to get moving again. So Evan, anything else to add to that?
Yeah. And even if you're not active and you're having shoulder pain just through your daily life responsibilities, that's something that you really want to get checked out for too. You know, if you're limited in playing with your kids or doing your job or doing your housework, whatever it may be, you shouldn't be living through pain. I always tell people, you know, you wouldn't want to drive across the country with your check engine light on, right? So that would be pretty dumb, I think. Right? Wouldn't be a good idea. So you shouldn't be walking around in your meat vehicle day to day and having your, you know, check body light on. You know, that's really important.
Wow, meat vehicle. You mind if I use that tomorrow?
Yeah, you could coin it.
All right. So all the information below. Hopefully we'll see you guys this weekend. Evan, thanks for taking a couple minutes out of your day to educate some people, and looking forward to see you on Saturday.
Ditto.
Thanks, bud.